Okay guys, so this is going to be a little bit different for those of you that are used to watching my channel and see me talk about my bikes, different bike stuff, and my Garmin and my Polar and different things like that. But I do like to talk about technology. I've been using Garmin and Polar and other technologies all the way back to the Cat Eye HB100. Today I have my Garmin Rally XT pedals that are doing my power meter. Got my Polar H10 heart rate monitor strap to do my heart rate. Got my Garmin Forerunner, and then my Garmin 840 for my cycling computer. So I rode down here to Newport Beach. Got about 45 miles in right now. I'll be riding back and getting my Century in. But I wanted to talk to you more about health and fitness, about my other thing that I do with my other channel and with building up that business. Well, it's been built, and what I've been doing over the years. So I just started the channel called Nurses to Tech, but I've been a nurse doing technology for about 10 years. And how I started was basically my interest in using tech on myself. And then what happened was the government passed some CPT codes. Those are reimbursement codes for those of you that are in the healthcare industry. So when you go to a doctor and you visit a doctor, and if that doctor does an office visit, he bills you a CPT code for that office visit, for an office consultation, an office follow-up. And then if he does different things, if he does an EKG or does an x-ray or anything like that, those are all codes, CPT codes. So that gives you some basic understanding, but you had to have been, and that's where I come in. It's a little bit unique with my background. I've been a nurse that's known about the billing side and compliance side of healthcare for a long time. I didn't grow up as a nurse in the typical bedside manner. I grew up as a nurse on the managed care payer side of things, and then on the provider network service side of things. So from a broader perspective. And I've been a case manager and technically a certified RN case manager, which is a unique thing to have. It's a specialty certification, just like a nurse that works ICU will get a certification in ICU. Nurses like me get certifications in case management. And many of you that are stumbling on this channel because I'm talking about remote patient monitoring, perhaps didn't even know about case management, or maybe some of you have and heard about it through case management companies. So those case management CPT codes have been around longer, and doctors' offices were able to case manage you with and bill for those encounters long before there was I'm at Newport Beach right now, so it's a little bit crazy. Anyway, so those codes have been around, and those CCM codes have been around longer, so more people know about them. And they could be low tech and not use technology and just capture the information in your electronic health record, your EHR. But the programs I use capture your information with apps similar to my app, like my watch and my heart rate monitor. But these apps are monitored by registered nurses, well, at least the good ones are. Some of them are monitored by care coordinators or medical assistants, but I hesitate with those type of programs, and I will advise any practice that consults with me to stray away from those programs, because you are taking a lot of liability for something that you don't have somebody that has the critical thinking and understanding to manage properly. I grew up in a world where we managed them with programs such as chronic condition management and disease management and post-discharge management and geriatric case management, so on and so forth, through different health plans. So I came up on the health plan side of things, where we had licensed clinicians oversighting the entire process and documenting and quantifying our work. So it's a little bit different than some of these RPM companies that are coming up now have basically come up like a typical app company. Just get a lot of users, get a lot of people pushing that data through their app and saying that they have a full program. Well, this is not. When you're in a remote patient monitoring program for chronic disease management, you need somebody that understands chronic diseases and has an education in that, and I will stand by that. But a lot of them don't. So, and a lot of them, even if they do have understanding and they have some nurses behind it, are those nurses certified case managers, and have they been doing case management and understand the bigger picture? Some have, some haven't. So I do believe we're getting to the point where we are going to align and certify everyone, but that day hasn't come yet. And it's tough, even with me working as a case manager for many years and working in hospitals and health plans. A lot of the staff that worked for me, even though they were registered nurses, hadn't taken that next step to get their certification. So back to RPM. RPM is a remote physiological monitoring that started with those CPT codes for the remote patient monitoring, the same thing. And when you can manage somebody by managing and watching their data and discussing their blood pressure readings and discussing their hypertension or discussing their blood sugar readings and discussing their diabetes, then you were able to bill code sets to the government, and you were able to have a program that could do this and be a practice that offered remote patient monitoring. So I went above and beyond just doing this as an advisor or consultant or a mentor or something like that. I did this with an actual practice and co-own a practice, still co-own a practice. And so we vetted it out through our practice. So we took that aspect of what the provider is going to see and what the provider needs to understand when we built these programs. So that's where we're at with this, and we are doing this as registered nurses, nurse practitioners, and physicians for various other companies. We're agnostic to what technology they use. We're staff development. We are teaching the theories, teaching the management and oversight of this, so people can have their own programs and use whatever technology that they feel they can use. Because let's face it, the technology can be just purchased very easily. It's just a software development kit that you can purchase and create your own software and put whatever else you want to put into it. They'll even put those drop downs and put that extra stuff in there if you want to develop it even further. So the technology is easy to do. So part of the technology is the fact that it connects to your devices, whether it's connecting to them through Bluetooth, using your phone or a hub at your house, or connecting them directly through cellular by having the cellular chip in the technology. So you can use either one, as long as if you're billing for them, they have to be FDA certified, If you're not billing for them, they don't have to be certified. They can just be, if you're just doing a wellness program and you're just doing CCM, and you can use anything and bill your CCM outside of the RPM, where you don't have to, there's only one code that you have to have the certified device, and that's 99454. So I'm going to whiteboard this where it'll be easier to understand. Sorry, I'm trying to navigate traffic. I'll talk to you guys later.